My next guest is an advocate in favor of decriminalization. Jess Lamb is the co-founder of the East Kootenay Network for people who use drugs, and she joins me now from Kimberley, BC. Thank you so much for your time.
Yeah, thanks for having me.
So what do you make of the growing political pressure now? We're hearing from local politicians in 3 different jurisdictions in the Lower Mainland calling on BC to halt the drug decriminalization program.
Honestly, I think it's insanity, considering the current landscape that we're under right now, with losing between 6 to 8 people a day. I just heard that a drug policy analyst also agrees that it would be a very bad idea to go back on decriminalization or stop the pilot.
Yeah, I think that last point in the expert that Tanya was interviewing there saying, well, we know criminalization doesn't work. Look where it's got us. And I don't want to have an unfair question here because we're only 1 year into this pilot project here, but is decriminalization as we have it in the pilot project in British Columbia, is it working?
I wonder that sometimes too, right? I'm a huge advocate around drug policy, and I know that other advocates had been saying that this is kind of a half measure of decriminalization and that it wasn't done in its full capacity. And because it wasn't done alongside with like safe supply, which is addressing the toxic drug supply, then that's kind of why we're seeing these issues that we're seeing now. There's a lot of focus on public substance use, but I think the housing crisis has more to do with that than decriminalization and a lack of services and places where people can safely use their substances.
You mentioned having safe supply alongside with decriminalization. The premise of decriminalization, for those who maybe are not completely aware, is the idea is to at least partly reduce stigma so that people will feel more able to reach out for help and will at the very least not use potentially toxic drugs on their own at home all by themselves, which too often we know it has deadly consequences. Yeah. To that though, when you talk about the public drug use, what do you say to those who are concerned about seeing those hard drugs, 2.5 grams of something like heroin or cocaine being used in public spaces like a bus stop, park or the beaches? What do you say to them?
No, I understand the concern, right? Like it can be weird coming across somebody if you're not used to it or if you haven't been exposed to substance use and you come across someone who's using in a public place. It can be really alarming or it doesn't feel right, but we also have to understand that we're in the middle of a public health crisis and that this is a public health issue and we're losing 7 to 8 people a day, and each one of those people that we're losing is someone, right? Like they're human beings. And because substance use has been around for a really long time, and we've got places where people can go consume their alcohol and things like that, but we don't have that for substances. So when there's nowhere to use your substance, I said this to the person who I was talking to earlier, if there's nowhere to go, if you're homeless and there's no services in your community where you can go safely use these drugs, the next best place is to do it somewhere public where if you do by chance have an accidental drug poisoning event, that at least somebody will be there to respond to you. Because as a person with lived experience of substance use, many of us are using not to kill ourselves, but to medicate or help the pain or trauma or whatever it is that we're going through. And I do want to acknowledge that not everybody who uses substances has a substance use disorder or it's like a problem, but I think that's why it's really important that we do have a safe supply of substances where it is available to anybody who's using their substances. And decrim plays into that as well. We see a lot of people who don't feel comfortable or safe asking for help around their substance use because of the criminalization and the stigma that goes with it. And decrim was really supposed to help the stigma side and make it safe for people to come get services or help when they need it. But I think because now it's become such a political issue, it's making it even harder for people to reach out and ask for the help that they need.
Just let me ask, I want to touch, before I have to let you go, because I've got time for one more question here, but I want to ask you about the politics, because we know that later this week, but there's going to be a meeting between BC's addiction minister and her federal counterpart. Given the discussion publicly happening right now, I think it's very likely they're going to be talking about decriminalization in British Columbia, whether to continue on with the next 2 years of this pilot project. What do you think is going to come out of that meeting?
I don't know. I really hope that it comes out that we're continuing with the next 2 years of this and that we don't fall back on it and rescind on it like Oregon did. I don't think it's right to be forcing treatment on folks. We know that that's not the answer, and it increases more harm in the long run.
That was Jess Lamb. Jess is the co-founder of the East Kootenay Network of People Who Use Drugs, joining me from Kimberley, BC. Jess, thank you so much for your time.
Yeah, thanks for having me.
Okay, joining us now is Alexa Loo. She is a city councillor in Richmond and one of 3 BC politicians calling on the province to scrap this program. Alexa, thank you so much for your time tonight.
Thank you for having me.
So we have heard this from others, from RCMP in the past, who have had an issue with the decriminalization pilot program. But why do you think the BC needs to end it early? It's only 1 year into a 3-year pilot.
The situation we're seeing on the ground in Richmond is things are getting worse. We're seeing more encampments, we're seeing more messes, more disorderly behavior, more theft, and we're seeing more people suffering on the streets. You can see people who have used, who are standing in the zombie stance. They're not well, they're not okay, they're out in the cold, they're not safe. It's not okay what we're doing and how we're leaving people out in the cold.
Where do you sit, and where does Richmond sit, do you think? I mean, in terms of supporting those who are dealing with addiction and the toxic drug crisis that is threatening their lives? Because there was a lot of controversy recently in Richmond as there was discussion about a safe drug supply or overdose prevention sites within the city of Richmond. And the decision at the end on the part of the health authority was just not to pursue it.
The decision in the first place was that we weren't going to get one because our numbers didn't justify it. So typically our numbers have been very low for the number of overdoses in Richmond and the drug use in Richmond in general that ends up being problematic like that at this level. So we've been a bit insulated from this for many years. The problem is coming more to the forefront in Richmond, and we're seeing more and more of it, especially as the decriminalization came. We've been seeing more people who are brazenly using out in public, who seem to be entitled to the spaces, to public bathrooms, to places where ordinarily everyone should be able to go. So we're seeing more problems with it. We're seeing more overdoses, more responses from our firefighters and RCMP, and we're seeing frustration in the inability to address people who have drugs and take their drugs away from them. Instead, they're given a pamphlet to say, well, here's how best to do it, and best of luck to you. Hope we don't have to call an ambulance for you later.
Yeah, and we recently heard those concerns from RCMP speaking in Ottawa about not being able to take what might be just 2.5 grams, which has been decriminalized away from somebody, like you say here. But on the reverse of this, the point of decriminalization is almost the hope that people who are dealing with addiction like this will use in an area, a space where they might be rescued or saved, or fire can find them because someone can see that they are having a bad reaction to a toxic drug. So out in the open rather than in their homes. So there's almost 2 sides to this. Do you see and sympathize with the other side, the idea that you don't want people who are using a drug that could be toxic, could kill them on their own inside a house?
Nobody wants anybody to die. Nobody wants that. And nobody wants anyone to be suffering from addictions or anything else. What we do want is we want accountability. We want people to, adhere to certain rules of how we're going to behave in society together. And open drug use is not one of those okay things. Getting together in the park and using and hoping that someone's there with naloxone, that's not the way to go about it. The people who are in their homes aren't going to get into their car and drive to the park to go and use the drugs. They're not driving anywhere else to go and leave. So that's not what we're seeing. What we're seeing is a growth in people, disorderly conduct, doing drugs in public, and not getting the supports that they need.
So Alexa, just finally, I went rooting for one more question here. The addiction minister in British Columbia is going to be meeting with her federal counterpart, we understand, later this week. What do you think is going to be discussed in that meeting? I imagine they will be talking about this. What's the solution you'd like them to come to? Do you have any suggestions?
I am hoping that we grow the number of treatment and recovery spaces for people and we make it the desirable route. So yes, you give people a fine or a ticket or something when they're caught with drugs. If someone has drugs and you take it away from them so they don't keep doing the drugs. And if that person says they're for personal use, well, that could also be a dealer using it for personal use and selling it to your kid around the corner. We don't want that. We want people to get healthy. We want them to get their lives back.
Well, and that is ultimately what everybody on all sides of this does want. Alexa Loo, thank you so much. Alexa Loo is a city councillor in Richmond, British Columbia. Thanks for your time.
Thank you.